Great. Good afternoon, everyone. My name is Sweta Ladwa. I am Chief of the Scientific Solutions Delivery Branch at the IT Application Center at NHLBI. I also serve as the Scientific Program Director for the Biodata Catalyst Data Management Core. Very happy to be here with everyone today and trying to advance slides. All right, yes. So I'm sure many frequenters of Biodata Catalyst may have seen this graphic previously. I wanted to bring it up just to refresh people's memories about what we are doing here at Biodata Catalyst. And so Biodata Catalyst does serve to support a variety of investigators, researchers, analysts, whatever the use case might be, in exploring various data types that would hopefully lead towards discovery, including diagnostic tools, therapeutic options, prevention strategies, and the like, to ultimately benefit the population in the US and abroad. So there's a lot of functionality that's available within our data science ecosystem that enables folks to collaborate, share, and scale analysis to facilitate all kinds of different explorations that they may be interested in. We have a lot of analytic capabilities available in the ecosystem. I'm not going to go through them all here because I've talked about them before, and I know others have as well in these community hours, but I do encourage folks to explore the ecosystem because there's probably something for almost everyone available in terms of analytic capabilities. NHLBI has been generating a wealth of data for decades. The Framingham Heart Study has gone back to as early as 1948 and it's multi-generational, but we have multiple of these cohort studies that are generating a wealth of data that's being shared in Biodata Catalyst. And we support a lot of these programs as well in providing them analytic workspaces in the ecosystem before data, while they're preparing data and towards sharing in the ecosystem. And so this is just a few, but I'm sure many folks who are familiar with NHLBI's portfolio of research are familiar with these studies, but there's a lot of data ranging from the various domains that NHLBI focuses in, including heart, lung, blood, and sleep research. We have several data generating programs. I went through most of these in my talk earlier this year, but just to refresh, we have TopMed, we have HeartShare, which is a public-private partnership in support of the Accelerating Medicines Partnership Program, the National Sleep Research Resource, the Pediatric Genomics Commons. We also support trans-NIH initiatives in working with the NIH Recover program that's looking at long COVID or post-acute sequelae of COVID, as well as the Regenerative Medicine Innovation Program. Both of these are congressionally backed programs. So there's a lot of stuff going on in BDC. We support a lot of data being shared in Biodata Catalyst. We support a lot of analysis in Biodata Catalyst. And so I think that there's a wealth of resources available to those who are looking to find data for various heart, lung, blood, and sleep related research efforts. So I'll move on to our data-related activities, our data update for the quarter. The last quarter that I presented was for the first quarter of the year. And obviously, given some of the holidays associated with early year from December to January, things slow down a bit. But as you can see here, they've picked up substantially. And we've, to this quarter, basically from about March to July, have released another 55 studies. That's not data set. So we heard from Kyle just now about what we consider a data set. These studies consist of multiple data sets depending on the consents that are made available as part of the studies. So these are 55 studies that consist of multiple more data sets than this. And so that ranges from BioLink data that's being brought in support of the HeartShare program and their efforts to analyze retrospective HLBS data as part of their effort. And also as part of our effort to consolidate NHLBI's data resources into Biodata Catalyst. And so we're kind of hitting two birds with the same stone. I know we don't like that. analogy, but that's, what we're trying to do here. We also ingested data from C4R, which is the collaboration of cohorts or for cohorts or something like that for COVID-19. There's a long acronym there that I'm sorry, I can't remember off the top of my head, but there's a lot of COVID-related data that are associated with the cohorts that NHLBI has been supporting as part of the longitudinal cohort studies I mentioned a few slides ago. And so these C4R studies also correspond with data that overlaps in TopMed in terms of whole genome sequencing, the parent cohort studies that have the phenotypic and clinical data. And there's also imaging and other modalities, including sleep, coming in for these studies as well. So we're looking at truly multimodal data coming into Biodata Catalyst. Connects is another COVID-19 related program. It's a network of COVID studies. So we've been continuously bringing data from Connects into Biodata Catalyst and have Active 4A data coming in. Active 4A was an international COVID clinical trial. There are multiple arms of that trial, and 4A is what we're bringing into Biodata Catalyst because there was NHLBI support of 4A for that large trial. We're also supporting continuous updates of data related to sickle cell disease. We have data starting to come in from our intramural programs that relate to human subjects. And so those are starting to come into Biodata Catalyst as well. You can see we have some imaging data that's come in from Framingham, Sprint, and Accord. Sprint and Accord are clinical trials that were conducted quite some time ago, but they had ECGs that were of interest to HeartShare, and so we've been bringing those in. We have brought in our second study from National Sleep Research, which was the HCHS SOUL study, the Hispanic Community Health Survey study, I believe that is. We have now Recover adult cohort data in Biodata Catalyst that's going to be continuously updated as data is released by the Recover program. And then TopMed, which is our Transomics for Precision Medicine program, and the updates based on the freezes that are made available by the TopMed IRC, or the Informatics Research Corps. Again, these are all the TopMed studies that we updated as part of this release, the quarterly release. And so there's a whole list of these TopMed studies, but these correspond largely with the NHLBI cohort, longitudinal cohort studies. We also have 11 studies that are partially available. So we didn't consider them fully released in BDC to make it 66 total because there is some additional processing by some of our platform teams that's done that takes a little bit more time. So for those people who are interested in accessing this data in Terra or in BDC powered by Terra, they are actually able to do so today. But it takes a few extra weeks to get it fully available across the entirety of the ecosystem. And so these are additional studies that will be available in the next few weeks. All right, so shifting gears a bit in terms of more data-related updates. We have been accepting submissions of data to Biodata Catalyst for several years now, beyond TopMed and some of our core data science programs. There's a wealth of data. We have over 4 petabytes of data in the ecosystem today, and we're going to continue to see that number grow, especially in response to the NIH final policy for data management and sharing. And so about 2 years ago, we awarded the Biodata Catalyst Data Management Corps to help facilitate upstream of Biodata Catalyst ingest, data management, and optimization so that the data coming to BDC from our data generators was or is optimized for reuse as part of the ecosystem. Because as we know, Biodata Catalyst as an ecosystem provides both a repository function as well as the analytic infrastructure for people to leverage that hosted data in the infrastructure. And they don't have to use that hosted data. They can bring their own data and do their analysis, or they can combine hosted data with data that they are bringing as well. So there's lots of options here. So we have a repository function, we have the analytic function, and those kind of come together as part of the Biodata Catalyst infrastructure. And so to get the data into Biodata Catalyst as part of hosted data, there is a lot of effort that goes into that. And a lot of people don't see that. I know our data generators who've submitted data to Biodata Catalyst know what that process is, but we wanted to spend some time to share what the process is to get the data into BDC if you are interested in sharing data with Biodata Catalyst. And you can see, I'm not going to go through every step in this diagram, but you can see that there are a lot of steps that take place in order to get the data into BDC in the current state today. We are working with the DMC and BDC teams to streamline this a bit, try to automate as much of this process as we can to limit the burden to our investigators in sharing their data in Biodata Catalyst. And so right now, I think the current process is kind of an amalgamation of some antiquated processes, some, new things, but, really trying to make sure that at the end of the day, when NHLBI is stewarding this data, that it's stewarded in line with the consents of the participants at the time of the study, and along with applicable policies and guidelines, whether, depending on the data type, like if it's genomic data, we want to make sure that the data is in line with the genomic data sharing policy in terms of its preparation. If it's imaging data, we want to make sure it's appropriately de-identified for sharing. So those are the kinds of things that we're trying to do with our data generators upstream so that when the data hits Biodata Catalyst for ingest, it's ready to go in the right format, de-identified, with a lot of those items addressed so that we are protecting the privacy of the participants who submitted their or participated in research, and trying to make sure that the data is optimized for reuse, especially for multimodal analysis. So you can see here with this diagram, a lot of the back and forth here happens in the middle between our data management core, our data submitters or data generators, and our data access committee, our genomic program administrator. And so that's kind of where you can see that there's a lot of steps to make sure that things are in place administratively, logistically, from a quality control perspective before we get the data into the ecosystem. So in terms of submitting data to Biodata Catalyst, there's documentation available on the Biodata Catalyst Gitbook site. There are 5 main steps, and I'm not going to sit here and say, just 5 easy, steps to get this data into Biodata Catalyst, but you can say that there are 5 just high-level things that people need to consider in order to get the data submitted. But those 5 steps consist of many sub-steps, so I'm not going to say it's a straightforward process today. So you'll send an intent to submit notice via email, and then you'll receive additional information as an auto response as instructions when you send that email. You'll get, in those instructions, you'll get the next steps that include how to initiate the dbGaP study registration process, because Biodata Catalyst leverages dbGaP for authorization in terms of what a investigator may have access to, depending on what they submitted as an access request to dbGaP. So we want to make sure that that access request is upheld when they're coming to BDC, and dbGaP is the source of truth for us in that regard. And so when an investigator is registering their study in dbGaP, it's basically allowing for the study to be registered so that dbGaP gets information in terms of the consent groups or the data use limitations associated with the individuals in those studies, the certification that the study or the data was appropriately de-identified according to the applicable policies and guidance. And so those kind of components are gathered in dbGaP, and that's what is used to then drive access requests by our DAC. And that's a whole separate process that I'm not an SME on, that I'm sure we could probably benefit from in a future community hours. But essentially, because we use dbGaP as our source of truth for authorization, the studies do have to be registered in dbGaP. So the instructions for that are provided as well. And then once that registration is complete, you can prepare your data according to the appropriate guidance. We have several resources for how to prepare your data, including on the NHLBI website as part of the policy updates for the new data management and sharing policy. NHLBI has its own guidance in terms of instructions for preparing clinical research study data sets for submission to NHLBI, and that is very solid guidance that's been put together by the experts across the Institute. So I would highly recommend that resource. Data de-identification, there's a README file or README document that exists on the Git book that people can reference. And then the data dictionary submission format is critical because we want to make sure that the data dictionaries we receive are machine readable. We don't want PDFs because those are not machine readable, because we want to be able to allow people, well, our developer teams need to be able to automate the reading of those data dictionaries to facilitate search across multiple data sets, especially in our BDC powered by Picture platform. But we also have other, search related use cases that we want to power, and that machine readable data dictionary is critical to that happening. So we really want to make sure that the data dictionaries are machine readable. Also for our end users, because I'm sure that there would be utility for our end users in having machine readable data dictionaries, but there's guidance there on how that should be submitted. And then there's other applicable policies and guidance, as I mentioned, like the genomic data sharing policy. After the data is prepared, you'll submit the data to BDC. And once we get the data, we do additional QC. If there's anything that we find in that additional QC, we send those findings back to our data generators to address the findings or clarify any questions we have. And once that confirmation is received, everything's clarified, QC is complete, we then proceed with ingest and on the BDC side. And that's kind of the end of the submitter's role until there's the release of the data in BDC, in which we let them know that the data is available now. And so we recognize that this is it could be a very involved process. We have help available. So we want to make sure that if anyone has questions, if they need help, we have the ability to contact the Biodata Catalyst Data Management Core via the link that's here. It's on the help desk on the Biodata Catalyst website. You would select data submission and the type for the field, and then you'd be connected. Your help desk ticket would be connected to the data management core, and they have a concierge service that will help you with wherever you are in this process, even if you're just at the beginning. But like I said earlier, we are working to streamline this so that there is more automation and a little bit more intuitiveness to the process. So those updates hopefully we'll be able to share in the coming year. But for the time being, this is the process, and we recognize that we can do better to make it better. So I'll conclude with some data related updates. The last time we met, I believe I mentioned that we had a Biodata Catalyst data model in development. It's a common LinkML based model to facilitate consistent representation of data rooted in standards and ontologies, to facilitate search and use case based harmonization. We are making progress on that data model, and we are looking at ways to make the harmonization outputs of the model available in Biodata Catalyst, so stay tuned for more development on that. We're also working on having our Fire server move to a production environment in Biodata Catalyst. For those who may not be aware, Fire is fast healthcare interoperability resources that support the exchange of electronic health record data. We are obviously waiting for a little bit more in terms of framework to provide to be able to actually exchange EHR data. I know NIH is participating in pilots to explore research as a use case as part of the TEFCA framework, which is the Trusted Exchange Framework, think, certificate authority. And so that's something that's in development with the Office of the National Coordinator for Health IT and NIH. And so hopefully as research becomes available as a use case as part of TEFCA, that we'd be able to then start having EHR data flow through our FHIR server. But we're on the path to getting that FHIR server through to production to be ready when that does happen. And part of that is also to support metadata exchange across the NIH enterprise as part of our contributions to the NIH Cloud Platform interoperability effort. We also have an effort for FHIR to be able to support social determinants of health data. There's a lot of work going on in the EHR space in terms of supporting social determinants of health. There's the Gravity Project and other efforts. And so we want to make sure that the data that we have in Validated Catalyst can be mapped to social determinants of health elements that are represented in US CDI plus, and that we can kind of leverage those for social determinants of health related research or just, other use cases as well. We're also developing a data submission and tracker tool. That is what I was talking about in terms of automating the submission process. So this would automate the current manual submission and provide some tracking capabilities for investigators for submitting data to see where their data is in the process. So hopefully that provides a little bit more visibility than back and forth emails. We also have DataCite DOIs now available in BDC, as Kyle just demonstrated in his talk before mine. And as he said, it's, the digital object identifiers will increase the fairness of the data, as well as tools and workflows, and benefit include the ease of reference for publications, among many others. We're also very close to our final stages of implementing the NIH Researcher Auth service that allows researchers data access to follow the researcher to the NIH computational environment of their choice. This is to facilitate interoperability across the NIH enterprise. And we continue to support our heart, lung, blood, and sleep researchers. And so, the feedback that we get from our researchers who are using the ecosystem, who want data available that they want to see in the ecosystem, we're listening to them and we're trying to meet them in terms of their needs. And so we are looking at additional data and metadata to support that. We're looking at continuous improvement to the ecosystem based on this feedback. So we really value our researchers' feedback. And I've said multiple times that the success of Biodata Catalyst really lies in the success of our researchers and the work that they're doing. So we really value that feedback and want to make Biodata Catalyst as useful to the community as it can be, so that the scientists can focus on the science and leave the infrastructure to us. Takes a village to build an ecosystem such as Biodata Catalyst and fuel it. And so just want to acknowledge leadership that's provided that village and their teams, because there's an extensive number of people that are working to make Biodata Catalyst what it is. And so really cannot say thank you enough for everyone's efforts.